as always, because we're doing a midline structure, I'm going to stand at the top. And I'm going to start off by drawing my aesthetic lines that go all the way from the brow down to the tip of the nose. This tells me where I want the projection of the nose to live between. And it also helps me to identify any areas where we may have a little bit of irregularity. So I can see here we have the dorsal hump there. Now if I just sit you forwards, if you can just, yeah, it's perfect. I'm going to turn you all the way this way. Let's take a look at this nose together, okay? So I really like this nose. I think, you know, it very much suits Lara's face, and I don't want to make any dramatic changes. Here we have the dorsal hump. We have a little bit of a dip before the hump, and so this will allow me to straighten the nose. If I just create some projection above the dorsal hump, that's going to create a really beautiful straight aesthetic nose. On the frontal view, there's just a little bit of irregularity as we move down those aesthetic lines, and so trying to smooth that out and create a really nice light reflex across the midline will really kind of give this nose that aesthetic highlights, which I think would be very, very nice. I don't want to do anything to the tip. I'm going to use Botox to reduce movements in the tip and the alar of the nose, the lateral cartilages of the nose. So my focus is actually the midline of the nose. I'm going to use a cannula to achieve that. The final thing I want to do is just assess the patient's eyelashes. So if you look straight ahead for me, like this, you look from the side view at where the upper eyelashes are. The upper eyelashes are in line with this line. This line then becomes the highest I want to take that nose. And if I took the nose, for example, up to the forehead, it would look very strange. And so the eyelashes actually give us our superior boundary of how high up the start of the nose is going to be, so that we can then treat the rest of the dorsum. Now I've got my landmarks in place. We're going to make a cannula entry point, and I'll show you how I treat the nose. So I like to use lidocaine just at the tip of the nose, and my egg is just underneath the tip. A little bit of a sting there towards Lara. Okay. Stingy?
A tad.
So I have to use a 25 gauge cannula in, because 22 gauge cannula doesn't seem to work in these in the tissue planes where we've got a very tight envelope of the nose. The other thing I want to mention is that in the bottom 30% of the nose, we don't have our concentric 5-layered structure, and so we have just a cartilaginous tip without any hierarchy of the layers of the face. I'm going to see you forwards just a little bit. Thank you. And so all of this area, we have no depth control, and that means that we can't reliably say where the blood vessels ought to be. So we have to be very careful in this tip of the nose. When we get into the upper 70% of the nose, from this muscle where the nasalis muscle is upwards, we have our very narrow concentric 5 layers of the face. And so we want to be injecting deep underneath layer 3 to treat the upper 70% of the nose. That's where we generally will find the avascular plane of the nose. But around the tip and the septum, we have to be very careful, because we don't have a predictable way to interpret where the major arteries are going to be. So let's go back. And want to now move to a 25 gauge cannula, just making an entry point just beneath the tip of the nose like this. And again, I always leave that a few seconds just to ensure that there's no cannulation of the vessel. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics.
If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
And then I move from the tip onto the nose dorsum like this. And you can find that resistance. That resistance here is showing me that I'm now at the point where we have the start of the 5 layers of the face. And I'm going to push through, staying in layer 4 of the nose, gliding along the perichondrium in this case, as I make my way up the midline. I'm not adding any volume to the projected dorsal hump. I'm going underneath it. So I'm just defining the aesthetic lines beneath the dorsal hump at the moment. All the time checking for capillary refill, noticing if there's any blanching or skin discoloration, checking that there's any discomfort with the patient. I always like to see bleeding. Okay, if there's a little bit of bleeding at the tip, that means there's healthy perfusion, and so bleeding is good when we're looking at nose injections. I'm now going to continue all the way above the dorsal hump, staying in layer 4, underneath muscle. And here we're going to need a reasonable amount of volume to project above that dorsal. But I'm going to keep the cannula moving as I add my volume. Comfortable? Great. We're using Miley Extreme here, so this is the most projecting hyaluronic acid in the Sinclair range, the Miley range. It's very suitable for nose, where we're trying to mimic the very tough underlying structures of the bone and the cartilage.
I suppose the other benefit for using a high G-prime product is you can use less of it, and in such a high-risk area, the less product you can use, the better.
Moving my cannula here just helps me feel like I'm safe or safer because I'm not adding a single bolus to any particular area of the nose. As I come out, I'm going to create a strip of filler all the way down the dorsum of the nose to really help create that light reflex that will look really aesthetic on camera or in photos or just as the light bounces off the nose. A little bit of definition at the tip of the nose here. Well, okay. Let's take a look. Any pain at all? No, zero. Zero pain. Fantastic. And again, look, we've got this bleeding, and really important just to check the tip of the nose, the cap refill. Cap refill's immediate. So I think its nose is looking really pretty. Standing from the top, I see that I need a little bit extra here still. So I'm going to keep working on the nose before I show you the results. Like Max was saying earlier, please don't feel the pressure to start injecting noses. You know, I know injectors that have been doing this for 10 years, thousands of fillers, and they've still not treated a nose, and that's totally reasonable position to have.
Are there any times where you would choose to use a needle over a cannula in the nose?
I'm still thinking about that. There are times when needle can definitely get better results. And in a recent study that looked at all the risks and complications of visual complications, blindness, for example, it was not conclusive about needles or cannulas in the nose. And so it's hard for me to say that even cannulas are safer, even though they feel theoretically and conceptually safer.
I suppose the benefit of the cannula aesthetically is that because you get less soft tissue swelling than you would with the needle, you can see your results a little bit better as you go. That's true. Which I hope you need to use a bit. That's correct. What sort of volumes are you using here?
So far I've almost used 0.5 ml.
Yeah.
However, I think that is all we're going to need today. One last look from the top, and I'm very happy with the symmetry, the balance of the nose. I've also created a little bit more balance to the tip of the nose where the cartilage is a bit more projected on this side than the other. From the side, and now straight in dorsum. Let's see forwards, Lara. Okay. So look straight into that camera for me. Okay, so from the front, I hope you can appreciate these brows moving now really centrally down towards this tip of the nose. If I turn you all the way to the side, you can see a beautifully straight dorsum of the nose, which is going very nicely with this convexity of the forehead, the nose. And if I turn you all the way this way, we can see that here with the, turn this way a little, the projected cheek apex, the very aesthetic nose, starting to see this all come together. Final treatment is in the lips. And I really like Lara's lips, beautiful volume, very good ratio already of lower lip to upper lip. We've got more volume in the bottom lip compared to the upper lip. There's no issue whatsoever with the amount of eversion of these lips. So there's very little to do, okay? What I would like to do is just create a bit more projection in the top lip. And the reason for that, again, if I can show you on profile, is the lower lip is very beautifully projected. Upper lip is slightly under projected. And so I'm just going to use a medium G prime product, mildly define. I'm going to use a needle, and I'm just going to pop out the upper lip and maybe do a very, very small amount in the bottom lip. And with the remainder of that gel, I'm going to inject it into the lower face on top of these muscles of facial expression. So if you stick your bottom lip forwards for me, like this. Yeah, exactly like that. These muscles are quite active, and if we can detach the skin from those muscles, what we'll create is a really nice softening of the expression in the lower face. And so if I can blend my filler that I'm going to use on my lip with just a little bit of fanning in the lower face, we'll really start to see the difference there. That would then give me my full treatment result, and we'll see everything. So I'm going to show you a bolus technique here, because when we have what I would describe as technically easy lips like these ones, we don't need to overcomplicate things. I'm going to let the filler do the work, and that means that I'm going to rely on the gel moving anterograde through the lip. And so if I just make my little entry point here, and then just slowly add some pressure, we will let this medial compartment of the lip fill. And I'm just going to go for a 0.1 ml bolus, because we're injecting really nicely low viscosity products that will flow. They're also cohesive, so they stay together. And even just after injecting 0.1 here, I can feel the gel between my fingers. It's traveled all the way to the midline. So that's how I'm going to create this very natural projection to the upper lip. A little one here as well.
When I started doing this, my worry was that the lips would just get to feel and look very lumpy with these boluses. But so long as you're respecting those compartments and, like you say, using a product on a softer, medium, no middle of the column kind of G prime, actually, you don't get any fat at all.
No. You started doing this in your practice as well, mate?
Yeah. I was nervous about it and actually somewhat skeptical.
But it only works in the right lips, like these.
If someone's skin is too thin, that is when you risk it looking a little bit lumpy. So if someone's got good skin, good volume already, and you only need small volumes, that's probably my go-to treatment now.
Remember with the lips that the major vessels live usually behind the orbicularis oris muscle, and so this injection, even though I'm doing a bolus like this, I'm conscious that my depth is still in front of muscle. That's really, really important. We don't want to do this deep in the lips. So for me now, it's really kind of helped to balance the upper lip with the lower lip. And just for completion, I'm going to do a touch in the bottom lip on each side. How's the pain in the lips?
So it's the most pinky thing.
The most painful? Yeah. The lips are always going to be the most painful of all the injections because of the sensitivity of the lips. The technique I've used there really minimizes the trauma and the pain. But you did really well. Okay, so this is just a little finishing touch that I want to do, which is just to create a little sheet of gel, hyaluronic acid gel, on top of the DAO muscle and on top of the mentalis muscle. And this just helps to really reduce some of that expression and soften the lower face, which I think will just create this final harmony for the treatment that we've done. So nothing complicated here. I'm just fanning into layer 2. This is something called dermal detachment, where we're just detaching the muscles from the overlying dermis, and in the process creating much more of a smooth transition throughout the chin, the lower jawline.
It's quite normal to get a little bit of bruising here. It's not necessarily because you call any vessels, but just that pulling the muscle slightly away from the skin naturally causes a little bit of subcutaneous bleeding. Often it won't present immediately. It'll be the next day or so that you see it.
That's it. That's all I wanted to do today, at least on this side.
What we learned in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
Let's take a look now at this entire half of the face with the other side untreated. I'm going to see forwards, looking into the camera. Beautiful. All right, so let's take a look at this side, untreated, and this side, treated. And I'm going to treat this entire side now, and then we'll see the full after results.
Okay, so now this is the toxin injection I'm going to do before looking at the full face. So the first thing we want to do is reduce the depressor septi nasi muscle, which is creating this dipping of the tip of the nose. I'm also going to inject the wing or the alar of the nose, which will reduce the flaring as well. So let's start off with just 2 units down into the nasal septum. That's to treat the depressor septi nasi. And for reducing the flaring to the alar, we're going to do a little intradermal couple of units, which the patient will subtly recognize as it kicks in over the following days. These are very small muscles involved, so we only need 1 to 2 units. The main thing I want to do now is look at the before and after, now that we've treated both sides of the face with filler. So with Lara looking directly into the camera, I hope you can really start to see the impact of this treatment. Really beautiful natural rejuvenation, starting from the top, treated the forehead to create this rounded convexity, moving into the temples in the interfacial plane to create this beautiful peak to the eyebrows and restoring that broader volume. I left the cheekbone alone, but I've enhanced the apex of the cheek and treated all the way through to the medial sooth using a blend of 3 different products to get that really nice soft transition from the cheek all the way through to the eyelid. I then treated back into the preauricular area with a soft product to address a sense of hollowing in this patient. And then with the nose, we used a cannula to treat the dorsum of the nose and also improve some of these small aesthetic irregularities to create this very nice straight dorsum of the nose, still natural, still retaining her original contours to her nose, not looking too treated or artificial. And then some balancing in the upper lip and a final treatment to reduce some of the muscle activity with a very soft product in the lower face. So all in all, a very natural full face treatment. And this is Lara looking into the mirror.
Tell me what you think.
I really like the nose. I like it all.
Well, yes.
Yeah.
What stands out the most?
My nose, for me, it's definitely straight down. Yeah, no, I'm really happy. I feel like I need a few hours to digest
You will
this.
definitely need a few hours. You will need a few hours. You did really, really well. Thank you for coming. And we'll get you back in a few weeks for a follow-up.
So welcome back to clinic. We're here with Lara again. How many weeks has it been?
4 weeks.
It's been 4 weeks on the day. So it's been 4 weeks since we did that quite extensive treatment. And just to remind you of the treatment we did, we started in the forehead, worked our way down to the temple, did the cheek apex and the under eye, treated the nose, and then we treated a little bit in the lower face and also the lips. So, by any definition, that would be a full face treatment. And I think Lara was a really fantastic model for us. So the first thing I want to do is just get your feedback of the experience of the treatment, if that's how it was for you.
It was relatively painless.
Okay.
The worst bit was my lips, which I thought would be the easiest, but everything else was close to 0 pain.
Fantastic. Love to hear that. I remember you telling me that during the session. And what was it like the first few days after treatments?
I was a little swollen.
Yeah.
But I saw the nose instantly. And then slowly as my face kind of less puffy, the cheeks really started to show. But again, it took only like 3 to 4 days. It was totally fine.
Amazing. So let's take a look at this. If we just zoom in on the face a little, I'm going to just show you what I see from this side. So turn all the way this way. I'm really happy with this really beautiful convexity from the filler in the forehead and the volume in the temples. It's kind of supported the periorbital area entirely. This is now what it looks like when the filler settles at the cheek, at the apex of the cheek and the under eye. There's no irregularity. There's no swelling or puffiness under the eye. So it's completely undetectable from from looking at it even this close up that there's been any filler treatments. The nose has still got its natural shape. You know, it's not perfectly straight like a ruler, but it has got this more aesthetic appearance from the side profile and a little bit of definition at the tip, which I really like. And then you'll see this, the lower face is a lot more relaxed. If I ask you to do this, yeah, see that one? Yeah, good. And a really big smile. Everything, all the muscles are moving very smoothly. And I can just see here a really nice enhancement to the volume of the lip as well. If you look from the side, the lips have got that little bit of roundedness. There's no migration of product. It's all looking very, like it's settled really nicely. So thank you for that. Thanks for being such a good model. What's the thing that stood out to you the most?
My cheeks.
Okay.
Yeah, for sure.
You mean this part or back, you know, here or here?
I just feel like, I don't know which part, but it's like that.
Okay.
I feel like that. And it comes through in like every picture that I have. Like my face is less heavy
Got
and
more
round.
more shape to the face. Fantastic. And what have your friends noticed?
My nose, which I didn't think was that bad, but apparently there's been a massive difference.
Okay.
And my forehead. And then people at work noticed my lips, so I couldn't get away with.
Everyone's seen a little bit of everything.
Yeah.
Brilliant. All right. Well, this kind of treatment your patients could have once every year, maybe once every 9 months, possibly even longer. And providing we are injecting in the right zones with the right products, with the right techniques, we shouldn't have any ongoing filler migration or movement. We shouldn't expect any complications, and more importantly, your patient should always look very natural. So I want to say a big thank you, Lara, for coming back and for joining us in clinic. We're going to show you the before and after photos now side by side. But until then, we'll see you next time. Thank you.